Thank you. It is a hormone produced by the
kidney or pancreas.
Oh my God. Help us, Lord. It is a hormone produced by the pancreas. And what's its job?
To decrease your sugar.
How does it decrease your sugar?
By putting the sugar in the cell.
It opens the door to the cell so that sugar can go in. And once glucose goes into the cell, what happens to it?
It turns into ATP.
How does it turn into ATP?
By oxygen.
Oxygen will
ignite the fire.
Start the fire that burns
the oxygen, the glucose.
Glucose into ATP, which is usable energy for your body. Are y'all with me? Okay. All right. There are a couple different types. They made like fake insulin, but it's like human insulin. Do y'all know the first insulin they ever made was
made from pigs, right?
Yes, they took all these, like, slaughtered all these pigs, took out their pancreas and like squeezed all the insulin out of it, and they were like, well, this isn't sustainable for a long period of time. So they made something called recombinant DNA technology where they made it like, yes, it's like fake human insulin. Okay. Now there is human insulin, which is synthetic, but they think it is as identical to human insulin as you can get. Then there's the human insulin analog where they're like, oh, human insulin, that's not good enough. We're going to bump it up. And they made it like better. Okay. You got me?
Okay.
Cool. All right. Before you give insulin, y'all know insulin can drop your blood sugar like that. You can cause hypoglycemia and you can kill your patient. So you need to make sure you know about insulin. This is very, 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 very important. Okay. So before giving, first of all, do not give insulins if they have precipitate. If they look kind of weird, like they've got little particles in it.
Oh, okay.
No, that's particulate or precipitate, okay? And y'all notice in all medicines, you need to look for that. There should not be junkies in it, okay? If there's junkies in it, don't give it. Okay. You need to swab the bottle top with alcohol. Y'all know to do that, I'm assuming. Okay. No air bubbles, because y'all know your insulin syringes are teeny tiny. So if there's any air bubbles in there, you're going to miss out on units and units and units of insulin. Remember, insulin only comes in units. Okay. You need to cleanse the injection site with alcohol. You should know that. The only insulin that can be given IV is regular. What is the only insulin that can be given IV?
Regular.
That's right. If they say like, oh, give NPH IV, question that order. They're stupid. Okay. And they'll ask lots of questions about that. Like, which of these insulin orders would you question? That one.
Yeah.
All right. All insulins are clear except NPH, which is cloudy. All insulins are clear except NPH, which is cloudy. All right. Injection sites and techniques. This is just a review. Y'all should have had this way back when. Okay. Yeah. You got a couple syringe sizes. They come in 100 units, 50 units, 30 units, or a 1 cc, half cc, or a third cc. Insulin is a teeny tiny amount. Okay. And if you don't do it right, you will murder a man today. Okay. So you're going to pick the smallest syringe for the units. And they may ask you a question like that. Like, you have to give 54 units of insulin to your patient. What size syringe are you going to use?
Oh, would it be the 5th out of the 16th inch?
Excuse me.
What?
You're giving it in units.
50 units?
You're giving it units.
Half a cc?
These are all the different sizes. So there's 1 cc size, there's a half cc, there's a third cc. Oh, I see what you're saying. Oh, you're trying to say that side. That's fine. So you're going to use I would use probably I don't think I'd use the 100. That's going to be hard. I'd probably use the 50 and then do a 30 unit to use the 4. You could do it in both. Okay. Or if I said like, hey, you need to give,
So which one is the sizes? Is it the cc or the unit?
Yeah, you're going to give it in units, but you may see on the packaging that it says like this is a 1 cc syringe. Let me show y'all. Hold on.
Okay.
I'll be right back.
No, I know they're really small. You okay? One. Just one. How about you?
Just one.
Oh, okay.
Okay, everybody's getting a syringe today. You're going to open it. Don't stick yourself, okay? All right, I want you to open it. Ashley, you want one? Okay. And y'all know you can open these like this.
Yeah.
And it's much easier. Okay. So I want everybody to open it and take off the top so you can see what it looks like and how teeny tiny that it is. This is, if you look on your package, This is a 1 ml syringe, but it has 100 units in it. Do y'all see that?
Yeah.
Okay. So then a half cc one would obviously have 50. You see what I mean?
Yeah.
Okay. So what they're saying is use the smallest syringe for the size. So like if I need to give 32 units, I'm not going to pull out a 100 unit syringe. You know what I mean? Like use the smallest one for, because it's just better and easier. Okay. And you'll see how tiny it is.
Yeah.
Because it's meant to go just like barely sub-Q. Really and the needle is very small. Okay. Yeah. But do you see how, may I? You can't have any air bubbles in here because you've even had the teeniest, tiniest air bubble. That's already like 3 or 4 units that you're missing. So you want to make sure that you flick out any and get it right up to.
You know, it's crazy that
don't recap a needle.
Okay. And then 2, that UTMB, I don't know if it's all the hospitals, but it used to be 2 nurses had to check your insulin.
Yes,
to
that
make
is
sure
still
before
true.
you gave it. Mm-hmm. But UTMB, nope.
That's scary.
Yeah. Only
so the rule is you're supposed to have 2 nurses check the insulin so you don't murder someone. I don't know why they changed that protocol, but that's a pretty standard across the board. You're supposed to have 2 nurses check it so you don't mess it up and cause massive hypoglycemia in your patient. Yeah. All right. Only NPH can be mixed with regular. What'd I say?
Only NPH can mix with regular.
And what color is NPH?
It's cloudy.
Everything else is?
Clear.
Very good. When you are mixing your insulins, you got to have regular before NPH. You're going to draw up the regular first and then draw up the NPH. Okay. And you can just remember RN. Like you want to be a
RN.
Yeah. So regular before NPH if you're having to mix the two. So if they say like, hey, I need 10 units of regular and your patient needs 12 units of NPH and you have to mix them in the same syringe, you'll pull up the regular first and then the NPH. Got it? Got it. All right. When you get the insulins, especially if it's cloudy, right? Yeah, you need to roll them. We never shake insulin. You just roll it in your hand to mix it. With? Okay. Patients may need sliding scale insulin while in the hospital. Why is that?
Because when
you're like
stressed.
I got it.
Well, if you're in the hospital, you probably have like an infection or something wrong with you. Mm-hmm. So you're gonna need a higher dose of insulin.
But why? Where is the connection there? Why? Why? Because they're stressed. Do they need more insulin?
Because of the cortisol.
Oh, so when your patient's under stress, they release lots of cortisol, and cortisol increases your blood sugar. So even if a patient's been perfectly managed, their diabetes is beautiful and they're managing it great, they get sick. That is going to cause a stress response in their body, right?
Yes.
Cortisol is going to be released, and one of the functions of cortisol is to increase blood sugar. So they may ask you a question like that. That's a great question. Would be like, oh, your patient who has very well managed diabetes is in the hospital for pneumonia. You are having to give them sliding scale insulin. They've never been using insulin. They just use oral meds. And the patient's concerned and they're like, am I going to have to use insulin for the rest of my life? How would you respond? She's like, just no. How would you respond?
You're only going to need it in the hospital because you're sick, and then because of your high stress or your stress, your cortisol levels are high. So that will increase your blood sugar. So we want your blood sugar to be normal. So
while you're in the hospital, you may need insulin, but we will try to get you off of that before you go home. Okay? Very good. All right, hypoglycemia treatment. If the patient's awake and alert, what's the treatment for hypoglycemia? 15 grams of a simple sugar followed by a complex carb. Now, if they are unconscious, are you going to be like, here's 4 ounces of orange juice? Okay. So we have 2 options if they're unconscious. Okay? Oh, I messed this one up, by the way. Put D50 IV instead of IM. Sorry, that's my bad. All right, so we can either give a shot of glucagon. Okay, diabetic patients have to carry around glucagon shot.
IV, right?
Yeah, sorry. Glucagon is like what diabetics will carry around all the time, similar to like allergy patients carry around an EpiPen. Okay, so if they go hypoglycemic, but they're not awake and alert enough to drink 4 ounces of orange juice, then we can give them a shot of glucagon. And what does glucagon do? What is glucagon? It is a hormone produced by your pancreas that tells your liver to give you sugar. Very good. Okay. If they're in the hospital and they're unconscious with hypoglycemia, we can push D50. What's the D in D50? Dextrose 50. Very thick. Sugary. Yes. Very much like syrup. You have to push it really, really hard in their IV to get it immediately to your patient. All right, let's go up to the top on the right. There is a drug called Exubera, and it is a insulin that can be given by inhalation. Isn't that wild?
Yeah, I never heard that.
Can you see your paper real quick?
Yeah.
I think there's something y'all can't see. Yep. Okay, so right here, I guess the printer didn't like this color. I'm going to walk y'all through what it says, so don't panic, okay? Nobody panic. All right, so what in that box should be, I know, y'all panic when you can't see something. All right, in that box is going to be different ways that you can give insulin, okay? What's the main way that we give insulin? What's the main route?
Oh, IV. Oh, no.
Main
Injection.
route. Sub-Q. All right, the main route that we give it is sub-Q. Y'all look at this needle. How are you going to give that IM?
Girl, I don't know.
Okay, so the main way is
Sub-Q.
Sub-Q. Now, there is an IM form, okay, if we run out of sub-Q sites or whatever. There is IM, so that's the next one, is IM. And IM means? Intramuscular. That one's going to be obviously a much bigger, deeper needle, okay, because it has to go through the muscle layer. You can give it IV, but what's the only type of insulin that can be given IV?
Regular.
Regular. It is the regular. You're from here, aren't you? That's how I say it too. All right. And then you can give it inhalation, but the only one you can give by inhalation is Exubera. So inhalation. The next way that you could give insulin is through a pen injector. So it actually kind of looks like this, but it comes like a pen, like an EpiPen. Yeah. Okay. And they can carry it around with them. And it's a little more subtle. It's like if you go to a restaurant with somebody and they're like type 1, they can just beep, and then just move on with their day. Okay. Yeah. The next way that you could give it would be an insulin pump. Now, what's the word I'm looking for? What is the advantage to using a pump? Do you know what a pump does?
It can be dripped, so given.
It usually goes like, it's a needle. It goes into like usually the back of their arm or something, and it's on them all the time, right?
The one
you know what I'm talking about? Yeah. And you can put them in different sites.
They have it like in their stomach.
Yeah, you can do it in the stomach. You can do it in the leg. You can do it in the back of the arm. And what's the advantage to having a pump?
Oh, because once your sugar goes low, it releases.
It will kind of manage it for you, because what happens is you're gonna eat, and then your blood sugar goes
high,
and then you give yourself
insulin,
and then it goes
down,
and then you gotta
go up,
eat, and then you got to give it, and it's like this, and it's just messing your body up all day. So insulin will give you a basal infusion. Basal means base, like basal dose. So it gives you a little bit all the time, and then when you eat, you tell it how many carbs you took in, and it'll give you a bolus. What's a bolus? A lot of something at one time. Yeah. Like if you go to the ER and you get an IV bolus, they're going to give you like 500 to 1,000 cc's of IV fluids one at a time. So bolus means a large amount of something. So in the insulin pump, you can use regular insulin, you can use Lispro, Aspart, or Glucoline. That one you should be able to see, right? All of those you can see. Okay. So those are the different routes that we can give insulin. Y'all with me?
So that's for the insulin pump?
That's for the insulin pump. Regular Lispro, Aspart, Glucoline. It'll give you a basal infusion plus a mealtime bolus. Got it? All right, for storage of insulin. So this is so backwards to me, unopened vials, if they're not open, they have to be in the fridge. Okay. Once you use them, they have to be at room temperature. Doesn't it seem the opposite?
That would be, yeah.
It does seem the opposite. And they can stay out for at least up to a month. Sorry, not at least. Up to a month. But they're not supposed to be exposed to sunlight or heat, which they shouldn't because you're in a hospital and there ain't no sunlight in there. Okay. There are some that already come pre-filled, like you don't have to draw them up. Those have to be stored in the fridge for 1 to 2 weeks, and they have to be upright. They can't be like this. They just have to be stored upright in the box. Okay. And then I put on here, what are some things that would increase blood glucose? Well, if they got sick, why would sickness increase blood glucose?
Because it's like,
what are they releasing?
Something's wrong, and it releases cortisol.
And cortisol increases blood sugar. If the patient's on corticosteroids, what are corticosteroids? Cortisol, which increases blood sugar. If the patient's under stress, what hormone comes out? Cortisol. What does cortisol do? Increases blood sugar. Okay. What decreases blood sugar? If they exercise, right? So what does their blood sugar have to be before we let them exercise?
100.
It has to be 100 before we let them exercise. If it's 80, what do we tell them to do? Eat something, we'll test it again, and then you can try again. Alcohol decreases blood sugar. I know it seems like the opposite. I think it's because we're thinking like we're drinking like fruity drinks or whatever, and it increases it, but it doesn't. It harms your liver so much to where the liver stops giving you sugar, and that's what causes the hypoglycemia.
But alcohol contains a lot of sugar, right?
Not straight alcohol. Now, if you're drinking a bunch of fruity stuff with it, then that fruity stuff contains sugar. But alcohol by itself does not contain any sugar. Like alcohol's keto. Like if you're on the keto diet, have at the vodka. Like you can drink as much of it as you want, right? Because it doesn't have any sugar. I'm not saying you should. I'm just saying. Don't look at me like that.
Liquor contains a lot of sugar.
No.
Neither?
No.
Like vodka?
Nope. No sugar. Okay. So that's why it's going to cause hypoglycemia. Now, if you add, juices and grenadine and all of that, yes, those additives have sugar, but alcohol by itself has none sugar. Okay. That's why you see like the real skinny girls out, you know, and they just get like vodka and club soda because it has like 0 grams of carbs, 0 grams of sugar, nothing. Those are your skinny drinks. Okay. All right. Do we understand the cheat sheet? The basics? We good?